So guys, I know you think we're about to do an open that has everything to do with dermatology.
Are we not doing that?
No, we are not doing that. I have a surprise.
Oh, no.
I'm scared.
I got a message on Sunday night and I have to play it for you because you wouldn't believe me if I texted you.
Okay.
This is a Costco food safety alert. Grimway Farms and the FDA have issued a voluntary recall on their Cal Organic brand 4-pound organic peeled baby carrots due to possible E. coli exposure. Our records indicate that you could have recently purchased the affected product, which has a best buy date of September 30th, 2024.
Recently?
Wait, it's November.
If you have any of this product remaining, do not consume. Please return it to Costco for a full refund.
Was that for you, Kara?
Yeah, I received this message on Sunday, November 17th, a couple of days ago. And did you hear the date? You purchased this on September 30th. And if you still have this product,
Yeah. Have you been experiencing diarrhea?
I was like, is someone playing a joke on me? We just did 2 episodes on leftovers and E. coli and all these things. I'm like, is this a joke? Like, did I manifest this into my life? But yeah, I just got that message.
Wait a minute. Do you still have any of that product?
How would I still have the baby carrots from September 30th in my
I'm
fridge?
just asking. You said that you just cleared your fridge out.
I did. You know what? That is a true story. I did text both of you this weekend that I was clearing my fridge out. So those baby carrots would have been gone because their expiration date would not be more than 2 to 3 weeks. That's crazy.
She's being serious. Be serious. She is not keeping her produce.
I'm not keeping my produce that long. But I was laughing so hard and had to keep it in and be like, oh my gosh, this is so good. We're playing this on the podcast. If you listen to that, not only does it say September 30th, it doesn't say I purchased it September 30th. That was the best buy date.
Oh, there'd be a lot more than E. coli on those by now.
Oh, gross. That drama's about to end, 'cause gross. Stop asking for a friend, taboos. Icky is what we do, just science. Yeah, it's not so weird. Your gross out journey starts right here on Oh, gross.
I know today we're here to talk about psoriasis and skin with a wonderful dermatologist, but I had to play that for you guys. I was holding it in since Sunday night. I was like, I have to play this message for them.
Well, I think the key word in that whole message is recently. I mean, are you kidding me? Recently.
Right. They need to speed it up a little bit though. Maybe text you like 7 to 14 days after the carrots are.
I would think that would be good.
Yeah. So anyway, but I had to play it for you, even though, you know, we are going to talk about everything skin today. We can't wait.
Yes.
I mean, the dermatologist definitely has some of the coolest gadgets around. It's literally like go, gadget, go.
Definitely.
It is. They've got Botox there.
Yep.
Lasers.
Yep.
Fillers.
Razor blades to cut off your moles.
Yeah, razor blades, exactly. And then they have those cauterizing tools that kind of like fire up, you know, after they want to close a little wound up. And my favorite, you know what my favorite is? The freeze gun. Like when it comes out and he comes in with it, it's
What's
like
your
something.
favorite?
The freeze gun. It's like cryo. It's so cool. He comes in with it.
Freeze off the warts.
Freeze off the warts, can freeze off, I think, skin tags they freeze off, right? Or just like little things on your, yeah. You guys are going to laugh. I don't know if you know this story, but my husband calls it my barnacles. Brian calls it the barnacles that grow on my head.
Yeah.
Yeah, I have this weird thing that I get like it grows on my head and he has to come and he cryos it off. Yeah. And it's like one time we asked, we're like, why does this keep happening? And my derm was like, well, you know, like how there's barnacles on a boat and like they kind of just sort of like grow back. It's sort of like that. So Brian's always like, how's your barnacle doing? Is it growing? Is it growing back? Yeah.
Is
Yeah.
it the same barnacle in the same spot?
It's the same spot. It's not cancerous. Yeah. I've had other derms cut it out. I've had, you know, they'll do XYZ and they'll say, oh, this is it. We're going to do it with a stitch and it won't come back. And sure enough, that barnacle comes back.
I really want to see this barnacle now.
That's about like once every 2 years, it'll come back and yeah, I got to check. It's starting to grow a little bit. It's going to take a couple of months because it's been about 2 years. So in like 3 months or so, you can check out my barnacle.
Okay. Return to the barnacle.
Speaking of people who love to check out my barnacle, I'm very excited to introduce my dermatologist, Dr. Ghasri, who's with us this morning. So good to see you.
Good morning. Thanks for having me.
Yeah, it's so fun because I know you see me a lot. I mean, what, about 4 to 5 times a year because I'm so fair skinned.
It's always a pleasure to see you, though. No, you and your husband are a lot of fun, so it's good to see you on the other side. Yeah, thanks for the opportunity today.
Yeah, we're super excited to talk about all things skin today.
Yes, we are.
Dr. Ghasri is a UCLA graduate with a BS in neuroscience. He earned his medical degree from UC Irvine, where he was elected to Alpha Omega Alpha Medical Honor Society. Woohoo! Way smarter than all of us here, right, girls?
Yes.
But most importantly, he co-runs Castle Dermatology in Tarzana with his brother. I am his patient. So is my husband. And we love him. And we're so excited to have him here today because I think one of the things about you that's so amazing is that a lot of people are scared about things they find on their skin, right? And you always have a way of calming your patients and making it practical and making us realize that get off Google, right? Get off Google.
Yes. Or TikTok or Instagram, all of the above.
I do need to ask, how many times, Kara, do you call him?
No, she's not on my radar. I'll tell you that much.
Okay.
She's not on my blacklist. No, she's a good one.
Yeah, I come in, I know better with the skin. I go in and I say, hey, except for, one time we had to hop on a Zoom because of my spider bite, but it wasn't a spider bite. You're the one who were like, it's not a spider bite.
They always blame spiders, but no.
It wasn't a spider bite.
It
was an allergic reaction. Yeah.
Okay, so we were going to talk about psoriasis, but now Jennie and I want to know about the barnacle that's growing on Kara's head. We have to know about it.
I dream about it every night.
I'm sure you do.
There's not a day that doesn't go by without.
It's a magical barnacle. It's a magical
barnacle is famous.
The real term for barnacle, although I don't use that term anymore, I think it's kind of a mean. So if a patient is rude to me, I will throw that out there. But
wait a minute.
No. I never use it on you. No, but the real term, it's called a seborrheic keratosis, and it's probably one of the most common skin lesions patients come in for to get checked out. A lot of them get freaked out. They notice that they think it's melanoma or skin cancer. And it's very appropriate for them to come in because I don't expect them to know what it is. Basically, it's this stuck-on, warty-like bump. They tend to be, black or brown, which is what worries patients. But it's completely harmless. And they usually just come with, age.
Wait a minute.
I don't like to use that term. So maturity, wisdom, experience.
Wisdom is definitely me.
Yeah,
Wisdom.
Exactly. That's where Kara gets it from. The good news is, though, they're completely harmless and treatable. We usually treat them with either freezing them with liquid nitrogen, much like we do to a wart, or we can remove them with just a shave removal.
And we've done both with me.
Yeah. So and yours, if they do keep recurring, I will send it to the lab for pathology because we don't want to miss a skin cancer. Yeah. Sometimes they just have a mind of their own, I guess, which is what's happening.
Mine has had a mind of its own.
Scary.
For the record, but my husband, Brian, always says that too. He's like, it's like its own little entity. And it comes back. Like it's been 10 years. Okay. For the record, mine started in my 30s. Okay. So I wasn't that wise.
You're just very experienced. I don't know what to tell you, but as long as we can check, I'm happy to check it every time and make sure it doesn't.
Oh, I'm going to make you check it again. I'm coming in next month.
Perfect. I look forward to it.
Definitely going to make you check it again next month.
And honestly, it is probably one of the most common reasons patients come in for. So you're more than welcome to come in anytime.
Is there any cause for it, or it's just like you're that person who gets the barnacle?
There's a genetic predisposition for sure. And much like skin tags, sometimes they can come from a lot of friction or rubbing, but they just appear when they want, where they want, honestly. There's no rhyme or reason.
Mine has a favorite spot.
Those are annoying.
Yeah.
Skin tags.
Yeah.
Yeah.
That's kind of like a baby barnacle to me.
Baby
barnacle. Yeah. Keep them cute.
That's good. I'm going to tell Brian because he always gets skin tags. I'm like, you get baby barnacles.
There you go.
Well, now back to psoriasis, what we came to talk here this morning about.
Yes.
So we want to talk everything psoriasis, and we have so many questions.
Sure.
What is the difference between psoriasis and dandruff?
So dandruff, the medical term is seborrheic dermatitis. It's kind of one continued spectrum. I would consider dandruff like the mildest form of psoriasis. And I always, tell patients it has nothing to do with hygiene or, washing. It's not your fault. It's just your skin is overproducing or overgrowing. And then psoriasis, it generally, technically is an autoimmune disease where your skin is just turning over too quickly. So you get these thick, silvery pink plaques. Common areas are the scalp, the elbows, the knees. It can get worse by scratching. And I know it can be very itchy. So That's the part that's most difficult to patients who try to stop themselves from scratching so it doesn't get any worse.
And when you say overgrowing, back to the dandruff, is it skin cells that are, rapidly growing?
Yeah, in the epidermis. Yeah.
So, Dr. Ghasri, there are a lot of myths or legends, we'll say, around psoriasis on the internet and in general. One is, for me, I need to know, my mother thinks psoriasis can be contagious. Can it be contagious?
The answer is no. You can't pass it to anyone else, but it can spread within your own body from, frequent scratching or touching or manipulation to it. But you can't give it to anyone else.
So if I'm sharing a brush with my mom, listen, and I have psoriasis, will my mother get psoriasis?
No, Mom. Leave her alone.
Can you explain that a little bit more? Like, how can it spread on yourself if it's not contagious? What do you mean? Can you explain that?
So when we look at psoriasis or dandruff, the main recommendation I can say is I know it's itchy, but try not to scratch it. It does make it worse. It can thicken it. With psoriasis, there's a phenomenon called Kebnerization, where if you induce trauma to one area, it actually forms new areas in those places where you created the trauma. So if you scratch it like in a linear line, you can get new psoriasis in those areas that previously did not have psoriasis. So if you're scratching your whole scalp, it can definitely make it worse. It's almost like the way of the body defending itself. So it overregulates and overproduces these skin cells.
And so it wants to live more. So it's like, come on.
I suppose. Yeah, if you want to get philosophical about it, I guess you can say that. Yeah.
Psoriasis wants to stay alive. Are there other myths out there, like on the internet or, in social media about psoriasis besides that it is contagious?
I think it's the whole, contagious thing is a big one. I think a lot of patients get afraid of using topical steroids, which still remains the first line treatment for psoriasis.
There are a lot of people on TikTok that are talking about a topical steroid withdrawal. The hashtag for this has had over 600 million views.
Wow.
Yeah, that's actually surprising. Yeah.
And a lot of these videos, they're made by regular people. They're not made by doctors or dermatologists. So what would you say to that trend that's happening?
Personally, I have never seen it. I think it's overblown, very much so. And it's almost, people are fear-mongering out there. Oral steroids, commonly prednisone, that can suppress the immune system and cause, adrenal insufficiency if you're on it for a long time. It's usually an oral steroid withdrawal syndrome. That can be very, very possible in a medical emergency, but not so much with topicals. The moral of the story is always see your dermatologist or other physician. There's a lot of misinformation about topical steroids on TikTok, Instagram, other social platform. Feel free to ask your doctors questions. You don't want to take something and then things get worse because of misinformation.
Okay, so I do have a question about psoriasis. Can it be a seasonal thing as well?
Yeah, it does get worse in the winter. So this is the season where we're going to be seeing more psoriasis patients. The sun, UV light actually tends to help psoriasis. Not that I would recommend patients go out of their way to get UV exposure, but summertime psoriasis is usually a bit calmer.
Dr. Ghasri, I actually had a friend who used UV treatment for her psoriasis. Is that because sun is good for psoriasis, can help as opposed to, cold weather?
Yes and no. Yeah. So UV therapy, ultraviolet light therapy, that's been around for decades. It's probably one of the oldest treatments for psoriasis. So it's basically concentrated sunlight. So regular sunlight has UVA and UVB rays, which can cause skin cancer. But the booths we use for psoriasis or the narrow band UV lights, it's just a certain small wavelength of sunlight that's targeted to reduce the immune system, basically, and that can help decrease the skin overproducing its cells. And that's why it's used for psoriasis. For patients who don't have access to UV therapy, I do recommend maybe get 5 minutes of sunlight a day. That's not really the ideal treatment.
My hairstylist yesterday, we were talking about this episode and she was like, oh, I have psoriasis. I've had it my whole life. And I didn't know you could get it in the nether regions down below.
Oh, yeah.
Yeah.
Ooh.
So she panicked. So she said that she thought that her boyfriend had given her something down there. And it turned out it was psoriasis. Can you talk a little bit about that for us?
The genital areas are a common area. I have plenty of 20-year-old guys coming in with, they just recently had a sexual encounter and they come in thinking for sure they have an STD, and it tends to be either mild eczema or psoriasis. But the penis, the genitals, it can be involved.
So the itch isn't always what you think.
It's not.
What does the talk say about the psoriasis down below? The TikTok.
I haven't. I don't know. I have not searched that yet. I'll look.
So, Dr. Ghasri, how can someone identify psoriasis in the nether region versus something else so people aren't relying on TikTok for their answers?
Yeah, that's a good question. There is a form of psoriasis called inverse psoriasis, which can affect the groin, the genitals, the armpits. Honestly, even for dermatologists, it's not always clear cut. It can be a fungal infection. It can be an allergic contact reaction. It can be more rare skin diseases. So yeah, don't rely on TikTok. Go see your dermatologist. They will, appropriately evaluate it. Oftentimes we can take a biopsy to fully confirm the diagnosis. But honestly, to answer your question, it's very difficult for patients to identify and diagnose it themselves. But if they have psoriasis elsewhere, like the elbows, the knees, the scalp, then that kind of gives you a clue that, hey, this could be psoriasis also.
So it goes back to what you've been saying, which is don't be afraid to go to your dermatologist.
That's the moral of the story.
Show them everything. Absolutely. They've seen it all.
Yeah.
Right.
Yeah. Oh yeah. Don't be shy.
Now, when you talk about psoriasis, I think that I've heard so many like natural remedies or people saying that if you put coconut oil on psoriasis, that's going to help. If you do this, a lot of people say it's diet. Are there natural things that can help someone with psoriasis?
Honestly, I think psoriasis tends to get worse with stress. So
I was going to say that's what happens with me. You know that. I come in your office and I'm super stressed out.
Definitely stressed. And I think, there are quote unquote inflammatory foods that can flare it up. So, high glycemic foods, oily foods can cause a flare of any skin disease for that matter. It's not like a first line treatment. I tell patients to avoid, certain foods, but that does play a role. But yeah, in terms of oils, I think honestly coconut oil is fine to use. It's not a cure. It's going to make it feel better.
Now, when you say that stress can cause psoriasis, can it cause dandruff?
Yeah, definitely. So again, dandruff is on the mildest spectrum of psoriasis. So certainly.
Is my husband listening? This is why I'm so flaky.
Yeah, you need a vacation then. Huh?
I need a vacation.
Yeah.
We know that if it's untreated, especially if it's in the, psoriasis realm there on the scalp, it can be very painful for patients. And we have patients come in that they've gone untreated for a long time and they think they have head lice, but it's really just really, really bad psoriasis. And when we try to, check them initially, their scalp bleeds. So I know it can be really painful if it goes untreated.
For sure.
How common is it?
It's probably one of the more common conditions we see. Definitely. It's our bread and butter.
It's your bread and butter?
Bread and butter. So very, very common.
Is cradle cap a form of psoriasis?
Yeah, that's essentially seborrheic dermatitis in babies. And some of those kids can go on to develop psoriasis, but it doesn't mean if you have cradle cap, you're going to get psoriasis. But essentially, yeah, it's a very mild form of it too.
My stylist was also telling me that there's a new shot out for psoriasis that people are talking about. What is that shot?
Those are the biologics. Honestly, I can count at least 10 different new injections out in the past 10 years. There's a new one almost every year.
Wow.
They're basically, because psoriasis it's an auto-inflammatory disease. So it's an overproduction of your inflammatory cells. So these injections called biologics kind of downregulate that system. And they're very, very, very effective. I usually use it in more like moderate to severe cases.
Okay. So I'm not a candidate yet?
I don't know. You don't need it, honestly. I mean, no, you're okay.
How do you know visually looking at your head if it's dandruff or psoriasis?
Dandruff tends to be just a very, 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 very mild form of psoriasis. So you just see just mild white flakes on your hair and scalp. Versus psoriasis, it tends to look a little worse. It's more pink. It's a lot more itchy. It's a lot thicker. And then more affected areas like the elbows and knees can be commonly involved too.
And the vagina.
And the vagina, I guess so.
Thanks, Kara.
Yeah.
Bring that up.
Let's not be sexist. Penis too. Involve us all.
What can we do down there? Like, I mean, I know what you do up on your head
You can still use topical steroids down there, but there's also a lot of non-steroidal anti-inflammatory medications too. So there's meds without the steroid component, so it won't cause any like skin atrophy, meaning skin thinning.
Can I use Head and Shoulders below the belt?
Yeah.
Really?
Yeah. I wouldn't recommend more than like a week in a row, but yeah.
Who knew?
Yeah.
Sounds like you need a follow-up visit. Come back and we'll take a look.
So what you're saying is you don't want me to treat myself?
Probably not.
Feel free to ask your doctors questions. They want the best for you. They want to advise you. We want to educate you. So if you don't want to take something and then things get worse because of misinformation. So feel free to ask.
And I think that's a really good point because Dr. Ghasri, when I come in, I might have questions or concerns. And if people are doing their own research, don't be afraid to go talk to your doctor about what you have read or you have seen, right? Because that's the open discussion. Not every patient's the same. And a good doctor is going to explain everything to you and find what's best for you.
Yeah, absolutely. Part of our clinic visits is educating the patient too. So
what do you find that patients are most embarrassed about when they come into you? Or is there anything they don't ask about because they're afraid to, that you'd like to tell people don't be afraid to talk about?
there's no modesty in a dermatology clinic. Let's just, take a look. I tell patients, I see 5 of these, 5 penises a week. So, or a day. So basically don't be shy to expose yourself in a derm clinic.
Drop your drawers in the derm.
Drop it and let's take a look. And, we see everything, below the belt line or under the broad line. I've caught plenty of skin cancers, precancerous lesions, atypical moles, and these are all treatable when caught early. So basically, don't be shy. This is all more important than whether you've shaved or embarrassed to show us something. We see it all daily. So don't be shy to show us whatever you need.
The
Thank you
shaving
for
thing
saying
is a
that.
real thing. Yeah, because the shaving thing is a real thing, right, Jenny? Yeah.
It is. Women are always, I feel like we're always so self-conscious about that. So I appreciate you saying that for everyone to hear.
There's no modesty in a dermatologist office.
And another subject that we wanted to talk about, right, girls, is ringworm.
Let's please talk about this too.
Yeah, we need to talk about it, right, Molly? Because there is such a debate and there are so many rumors on how you get it. My husband, Brian, always says that his mother would be like, don't jump in a puddle, you'll get ringworm. And what is it?
Ringworm is just the layman's term for fungus or tinea. So there's different forms of tinea. There's tinea capitis, which is fungus of the scalp. There's tinea corporis, which is fungus of the body. Tinea cruris is fungus of the groin or jock itch, commonly referred to. But
Wait a minute. Back it up.
Do you have it?
Hold
no,
on.
you don't have it.
No, I don't have jock itch, but it's the one thing I don't have or think I have. But wait a minute. I didn't know that ringworm was jock itch too.
Jock itch, it's kind of like this over like arching umbrella term for anything down there. Ringworm or eczema or psoriasis. People just call it jock itch. But ringworm can be a form of that.
And
or a
ringworm
subset of that.
It's not caused by a worm, correct?
No, there's no worms in ringworm.
Okay.
I guess I never even thought about that. No, I don't know where I got the name ringworm, actually.
I don't know either. It is round. I used to get it in undergrad when I would work at the vet during underground and had to hold, restrain an animal and it would rub, on my
100%.
skin. So we were always getting treated for ringworm. But
100%.
Molly got ringworm from a child who had it on the scalp.
I had put a cape around a child and I did not know that they had ringworm. I did not have my gloves on though first, which that was the number one mistake that I made. Always have your gloves on before you're going to touch a patient. And I ended up going to the restroom and the next day I actually had Jenny inspect.
Wait, down below? You got the ringworm down below?
It wasn't down below, but when you pull your pants down, it was right at my hips and right across my back area a little bit. So it was really itchy. And I had Jenny come up and look at it. And she said, yeah, it looks like ringworm. It was in a ring and very itchy. And of course, here I am now with ringworm along with impetigo. Great.
But I'll tell you, ringworm I feel like it gets overdiagnosed. People come in with eczema or psoriasis and they automatically think it's ringworm. I think that's the most common mistake they make. So there's a condition called nummular eczema, which looks exactly like ringworm. It's a round pink patch, but it's not as quote unquote angry looking. So a lot of people think they have ringworm, but it ends up being eczema and we treat it completely differently.
I have to tell you, in my mommy Facebook groups, that is the number one thing that people post about. And they'll be like, is this ringworm?
Yeah.
Is this ringworm? It's always the picture that they always are posting pictures and saying, is this ringworm?
I honestly don't see it nearly as much as eczema or psoriasis. But Jenny mentioned working at a vet. So that's the first question I ask. When it does look like ringworm, I ask them, do you have any pets? Do you have any dogs? It's also commonly transferred from soil. So have you been do you work with dirt or do you garden? Have your kids been playing in the dirt? Those are the two more common ways of getting it, animals and dirt.
So when Brian's mom would say, don't jump in the muddy puddle, that actually...
She's sort of right. Yeah.
Yeah.
Yeah, shout out to her. Yeah.
Yeah, there you go. Jennie was right.
When I would get ringworm, we'd either get something from Dr. Corey, the vet that owned the clinic, or, for example, when Molly got it, I just went to the grocery store and got her the little fungus the antifungal you can use on, your toe and just put it on the little spot and it cleared right up. So
yeah, the over-the-counter stuff is okay. I mean, there's plenty of prescription meds that are better, and there's oral pills too for it.
Well, what about athlete's foot? Is that ringworm?
Technically, yeah, that's tinea pedis.
Wow.
But I feel like that's also overly diagnosed. Even patients with like dry feet or eczema, they think it's automatically ringworm. But
so that spray when you were a kid and you were like in track or whatever was really like a ringworm spray for your foot?
Yeah.
Antifungal.
Antifungal. I had no idea that ringworm is like everything, basically.
It's everything, but it's also not everything. It's not always ringworm.
Well, walk us through it. Describe how you know if you might have ringworm.
It's more of a thicker pink plaque that's more scaly on the edges. It has basically this scale tends to be, we call it leading scale. It tends to be around the circle. It's hard to describe it, but it just looks more aggressive than eczema or psoriasis. And then there's a deeper form of ringworm you can get called Maiocchi's granuloma, where the ringworm actually starts invading the hair follicles. So you get these little pustules around it too. And that's very common on the wrists. So if I see this pink, thick, inflamed plaque with little pustules on the wrist, I automatically will treat for a deep fungal infection with a longer course of oral antifungals.
Yeah, where is it most common to see ringworm on your body?
Everywhere and anywhere. I think the arms, the legs. I mean, I have a couple of patients I've treated on the neck recently. So honestly, everywhere and anyanywhere.
Is hand, foot, and mouth disease, is that a form of ringworm or?
No, that's more, that's a viral infection. It's like the Coxsackie virus.
But ringworm, just to go back, it is a ring. It will look like a ring.
Yes. No worm, but yes to the ring.
Okay. So there will be a ring, but there will be no worm, people. Do you hear that? There is no worm.
And doesn't it get bigger if it's not treated? Because we saw a patient that the mom was treating with, a steroid for something else. And so it made it worse. Yeah. And the child, it literally circled his whole cheek.
When ringworm's on the face, it's called tinea faciae. And topical steroids, essentially, I tell patients it's like feeding the fungus. So it does make it worse. And that's how you can get that Maiocchi's granuloma, which is the deep fungal infection. Those patients thought they were treating it for eczema or psoriasis because, again, they all look similar. So they were essentially feeding their fungus with these topical steroids. It's essentially what it sounds like, fungus on steroids. So they grow and they grow deeper and they're more aggressive.
That's why don't be a Dr. Google.
Yeah.
Go into the derm and drop your drawers. Don't be a Dr. Google.
Dermatologist. Yeah.
Be a care and ask the questions.
Ask the questions. Ask
Kara's
a lot.
Perfect patient. Yeah.
Ask a lot of questions.
Yay, Kara.
Very appropriate questions. Yeah.
Yes, appropriate questions.
Yeah.
Well, and what about hygiene in general? Like, what could you tell people? What can they do to prevent this? I mean, obviously, a lot of these skin conditions are highly contagious, right?
Mm-hmm.
Are there certain practices that you tell your patients will help?
I mean, basically, a lot of our patients who get these they're kids who play sports or, adults who work out regularly. So just wash off right after, take a shower after working out, take an extra shirt with you to the gym, change your clothes right away and wash off, and you should be okay.
Or wipe down your machinery.
Wipe down the machines. Yeah, don't share towels. You can get a hypochlorous acid spray. You can just even get that over the counter from Amazon. Spray your body right after. That helps decrease the bacterial load as well.
But can you explain to us what it does? Like, do I need to get it for my husband now?
Basically, hypochlorous acid is just, it's even over the counter, so it's not even prescription, but it's basically this reactive oxygen that's formed from chlorine dissolved in water. It just basically has antibacterial, anti-inflammatory properties. So it's great for acne-prone skin. Patients, after the gym especially, you can spray it down and it helps reduce the bacterial load.
And if you get it on Amazon or anywhere, it doesn't matter. It's all the same.
I think that's fair. Yeah, that's what I recommend to patients. Nothing too fancy.
I don't know, girls. Do you always wipe the machine down before and after the gym? I mean, I feel like I watch people do one or the other, but they're probably like doing it to be nice for themselves.
I work out mostly at home now, but when I was going into the gym, yes, I would wipe before and after I used the equipment.
Yeah.
Because I didn't want to get ringworm again. Okay.
If there's a ringworm out there, Molly's getting it.
Yeah.
Sounds like it. Sounds like it.
Okay, so I have a question, and this just came up because I have 2 teenage boys who are very smelly, and I need to know, how often are you supposed to change your bath towels and your bath sponges?
Oh, that's a good question. I mean, I'm a guy too, so I was once a teenager. I would say every few days, I think. But if your bath towel is just trapping moisture, that's where the bacteria and fungus can grow more. I would say if you want to play it safe, every couple days.
What can you get from your bath towels?
Bath towels. I mean, you can get molluscum, you can get warts, you can get fungus. Again,
Wait,
I don't want to.
The molluscum. You have to do the layman's version of molluscum. You and Jennie throw that term around like everybody knows it.
So molluscum it's the full name is Molluscum contagiosum. It's basically like the cousin of a wart.
A wart's cousin.
It's these little tiny white bumps that a lot of kids commonly get, but they're very, very contagious and spreadable. They kind of spread through water easily, so kids get it after the summertime from swimming pools. Just like warts, they're not dangerous, but they can spread very easily. So you want to target them and treat them. And we treat them similar to warts. But towels, I've seen molluscum in places below the belt from towels.
So towels 2 to 3 days, and then bath sponges once a month, once every couple weeks.
I think once a month is fair. That's more than. Yeah.
I'm just stuck on the fact that the barnacle, the molluscum, and the wart are all a little family together.
I know, they're good family reunion. And patients come in with a trifecta too.
Little trifecta family.
Yeah.
Aw, how cute. I have a really crazy question for you. How fun is it for you to use that freeze gun when people come into your office? I know this is like off subject, but like, is it amazing? Like I get it. The little freeze gun, like when you pull that out, when you pull that thing out with me, I'm like, man, that's
I
like
go to
cool.
sleep with that bad boy. Yeah.
Yeah, it's so cool. Is that your favorite part of your job?
It's our number one tool. Yeah, for sure. Because that basically I use that to treat warts, molluscum, precancerous lesions.
Moles?
No, we shouldn't freeze moles. No, that's a big misconception.
Skin tags. What about
skin tags? Yeah, get those off.
Sometimes I freeze them if they're little, or I snip them off. We numb them, just snip them off with little scissors.
You're always freezing stuff off me. I'm like, I'm getting the freeze gun out. Yeah. My Irish heritage, get that freeze gun out.
That's our go-to for sure.
So, Dr. Ghasri, have you had an oh gross moment as a dermatologist?
I'm prejudiced because I'm not grossed out by like blood and guts and sweat. But I could tell you about one of the coolest things I saw once is about 7 years ago. Actually, it was on Halloween. I remember that specifically because it was freaky. He came in. It was this nice older man. He was in a wheelchair, and he came in for what I thought was a cyst on his back. So I said, okay, let's open it up, let's drain it. And as I'm working on the cyst, trying to get the shell out, I'm just talking to him and conversing. I asked him what happened, what made you a paraplegic? Because basically he was in this wheelchair. He's like, well, about 30 years ago, I got shot in the back. And as he's saying this, I open it up, and it turns out to not be a cyst, but I pull out this bullet from his back.
Wow.
I'm like, it was just unreal. And I was actually freaked out a little bit. I'm like, I don't know much about bullets. I don't own a gun. That freaked me out. But we found the bullet that was lodged in his back still, and that was the bullet that made him paraplegic. So that was one of the coolest moments I've experienced.
Wow. Because the skin, I know when I was little, I fell down playing kickball because someone tripped me. Her name was Melissa. We won't say last names. And I got my knee was really cut up. And for some reason, the doctor, he should have cleaned it out better, and he should have stitched me up, and he didn't. But a year later, you would kneel and say your prayers at night. I had this like cyst kind of thing under my kneecap that was bothering me. And my dad eventually pulled out a piece of glass that was like from a bottle.
Wow.
Ooh.
Yeah. That had pushed out through the skin. Is that kind of what happened? That bullet must have been pushing up and up and up.
Pushed out. Yeah. Yeah.
But it took 30 years, not a year. That's crazy.
Yeah. It was in there for a long, this guy was like in his 80s. Yeah.
Wow.
It was a long time. But we've taken out, I found random pieces of glass from 5 years ago. One guy told me a story about he was like gardening, and he fell into a bunch of cactuses. He came in months later with I had to take out these cactus thorns from him. So
wow.
Yeah, people, there's things we see.
I know you have to go be a doctor now, but
Unfortunately,
we could talk to
more.
we could talk to you for like another 2 hours.
But
So will you
come
come
make
back?
your follow-up visit and we'll chat more. But thanks for having me, though.
Well, we hope to have you back again too, please. We have so many things to talk to you about.
I'd love to. Yeah.
Yes, we'd love
Thanks
that.
for joining.
Anything skin. Thank you. Thanks, guys.
That was so informative. And I think I'm going to have to buy some of the hypochlorous acid mist spray for my husband. I don't know about you guys.
Yeah, that was really interesting. I didn't know they made sprays like that.
I know. It's really good for people that work out. So good information. And, talking about good information, we see so many kids that come into our clinics with ringworm, and it's more common than people think. It's something like he said that affects so many different areas of the body, and not just the spray, but just showering, bathing, not sharing towels, not sharing clothes that aren't laundered, things like that. That's a really good way to protect yourself from getting ringworm. And also, if you pet animals or you go volunteer at the shelter or you pet a dog in the dog park, you should always wash your hands, right? Just washing your hands, washing off your arms before you go hug your kids, because just like I used to get it working at the vet, if you are touching that animal and you scratch yourself or you put a cape on a kid without gloves
Like
that
Molly,
has ringworm and you scratch your body. Right?
Yes.
But Jenny, I have a question for you. I was curious about why is it more prevalent in animals? Did when you were working at the vet, did you find out why that was?
Well,
the case?
a lot of the animals we would see it in were outside animals. So a lot of dogs that are outside dogs instead of inside, or if the dog goes outside and, rolls around in the dirt, or like you were saying, jumps in the mud, then you definitely could, you could get it. So, washing your pets, that especially if they're inside animals, is also a good idea. But it's pretty common sense. Just like a lot of the things we talk about is just keeping everything clean and washing our hands.
We have this whole stigma I think we should talk about around dandruff and psoriasis, right? Like, yes, you can reduce your stress. Yes, these things are treatable, but if you're a person who's prone to it, we have stress every day, right? We're constantly under it. But for some reason, like, there's flakes on your shoulder. Right? It makes people think you're dirty or your scalp is gross. And that's not true. Yeah. There's nothing to be ashamed of. Look at me talking all about it and all my flakiness.
Hey, I get it too. Change of season. So
yeah, it's
definitely Head and Shoulders will knock it out for me.
So I'm really fascinated about this spray. So basically it's the same as what we use on wipes for bikes and things, correct? But it's for your body. Is that what it is, Jenny? It kills the bacteria in your body?
It is. It's this FDA cleared antimicrobial spray. And a lot of people use it to clear up different things on their body, like eczema or wounds or things like that. So it can kill nasty, gross things.
From the gym. Because
yes.
I honestly think gym etiquette is interesting. Like some people are the people that are like, I'm going to wipe down the bike before I go on it. Others are, I'm going to wipe down the bike when I get off it. And there are a few people that see do both. But don't you guys ever watch and see people like who are they caring about, themselves or other people when they're at the gym?
No, I think that's a really good point, because I've seen people wipe down before, but then they're using the same towel to keep wiping down.
Right.
So I think we need to figure out, like, how many towels do you need to have at the gym? Because I've seen people and they sweat and then they'll wipe themselves and then they wipe the bike down, or
like they wipe their
equipment.
face. Yeah.
Right.
But it's not just that too. I mean, like if you watch, like they'll do this, they'll wipe their nose and then they'll, like hold on to something. And then a lot of people will not wipe off after. And you can tell too, because I've been in the gym before and you can see people like looking around to make sure that no one's watching them and they just won't wipe it down. And then the next person comes along and puts their hand on this that's already waiting there, the snot that's waiting there. So
well, and it's so crazy because the amount of time it takes to look around, you could have wiped down the bike with the wipe.
Yes. let's wipe down our equipment and get rid of those viruses and all that bacteria.
But now we have a spray we can use
yes.
on ourselves to protect ourselves.
Have you had your own encounter with ringworm, psoriasis, or a mystery rash? Share your story at ogross.com. and it might just be featured in a future episode.
New episodes of Oh Gross drop every Wednesday. Love what you heard? Leave us a review or share this episode with friends, family, or anyone who could use a little Oh Gross fun.
Still scrolling? Follow us at It's Oh Gross on Instagram, Facebook, X, TikTok, and YouTube to stay in the loop on all things Oh Gross.
Oh, gross. That drama's about to end, 'cause gross. Stop asking for a friend, taboos. Icky is what we do. Psoriasis, podiatrist, and pinworms too. It's so gross. No need for strife, because gross. Life is part of life, it's just science. Yeah, it's not so weird. We got the facts, nothing to fear. Oh, gross. It's just science, no, it's not weird. It's just science, nothing to